come in.
Hi, good morning. How are you doing today?
I'm good. How you doing?
I'm doing well, thank you. My name is Christine. I'm one of the nursing students. Can I have your first and last name, please?
Yeah, it's Chris Brown.
And then can I have the date of birth?
8286.
All right, beautiful. Is it okay if I perform a health assessment on you?
Yeah, for sure.
Okay, I'm just going to perform hand hygiene. I'll be right back.
All right.
All right. So I had a few other questions for you. So do you know exactly where you're at?
Yeah, I'm at Bethesda Hospital.
Okay, and then do you know why you're here?
I'm a diabetic, so I think I had an insulin reaction.
Okay, all right. Do you know what the date is? What year we're in?
Yeah, today is October 4th, and it's 2021.
Okay, beautiful. And then do you know who our president is?
Yeah, it's Joe Biden.
Okay, so according to the Glasgow Coma Scale, Chris is awake, alert, oriented ×4 by person, place, time, and event. Alrighty, so right now I would like to just do some more assessments. I want to check your head. As I'm checking the head, I want to inspect to make sure that there's no infestations, no like lice, no debris. I want to make sure that it is proportional and that it is proportional to the body, which it looks that way. The facial features, I want to make sure that it is symmetrical. The eyes are where they need to be at. It's aligned. They're equal. I also want to make sure that the eyes are fine. There's that it's white and there's no redness in the conjunctiva area. The ears are aligned. Now I'm going to be feeling it, making sure that there's no indentations, no pressure injuries. And that's one thing that is always very important is that, you know, when you check for pressure injuries, that you want to make sure that you check in the bony prominence, and that's when you would do the skin assessment and you would do the braiding skin scale. So now I would inspect the ears, make sure that there's no drainage or anything like that. Do you feel any tenderness as I'm touching you?
No.
Okay, all right. I want to make sure that there's no redness, no pressure injuries. All right, if you can feel your temporal pulses. All right, those are evenly bilateral by +2. And then, do you hear?
Yes.
Do you hear?
Yeah.
Okay, so, all right, if you can close your eyes for me. Do you feel? You feel?
Yep.
Do you feel?
Yep.
And then do you feel?
Yeah.
Alrighty. And then now, if you can open your eyes for me, I want to make sure that your nose is aligned and everything's good. There's no redness, no irritation or anything like that. Alrighty. I want to check your eyes. It's nice and pink, just how it's supposed to be. Now I want to check your pupils. Okay. Okay. All right. So the pupils are equally rounded, and it's reacted to light, and they also accommodate. I want to also check to see. Can you press your hand? Alrighty. If you can give me a smile, a frown, a puffy face. All right. Can close your eyes. Tell me what you smell.
I smell lotion.
Lotion, okay, beautiful. Alrighty, I also want you to check my badge here. If you can open your eyes and tell me what you see.
RN student.
Okay, beautiful. And then if you can just follow my pen without moving your head. Alright, beautiful. Okay, and also if you can occlude the nose, make sure that you close your nose, block your nose, I'm sorry. Okay, and then take a deep breath, let it out, and then do the opposite. Take a deep breath in, let it out. Beautiful. All right, check your mouth, make sure everything's good. Can you open it for me? Make sure there's no dental caries, no broken teeth, no cuts, no lesions. Lift your tongue. All right, can you move it side to side? All right, can you stick your tongue out? And then say, ah. All right, check your gag reflex. Okay, everything is good. Can you open your mouth for me? I'm gonna resist that. All right, can you really swell it for me. Alrighty, beautiful. Right, so now I'm gonna check your neck, make sure that everything is aligned, make sure that the trachea is aligned. Alright, which is fine. There's no bumps, no nothing like that. Check your lymph nodes, don't feel any lumps. Do you feel any tenderness as I'm touching you?
No.
Okay. Alright. Alright, so there we go. So then I would check the chest, make sure that it is it's symmetrical. There's no bumps, lumps, nothing like that. Color seems fine. I want to check your extremities. So let me see your hand. Okay, looks good. It's nice and dry and warm. Check your capillary refill. Capillary refill. Right. Those are both equal bilaterally +2. Those are both equal bilateral. I already checked. And then check your radial. And then your ulnar. And I already have you check do your finger strength, right? Okay, so finger strength for me. There we go. And then just want to check your arm strength. Okay, press down up against my arms. And then press up against my arms. There we go. Everything's good. Nothing there. No swelling, no edemas or anything like that. And then from there on out, I would want to start checking his heart sounds. And then first I would check his vital signs. I would check his pulse. I would check his respiration. I would check his blood pressure, and I will also check his temperature. All right. So then after I do all that, so I would go to the right sternal border, which is in the second intercostal space. This is where I would listen to the aortic valve. Then I would move over to the left side, where I would go to the left sternal border, second intercostal space, and this is where the pulmonic valve is at. Go to the fourth intercostal space over the left sternal border. And then I would go to the mid-subclavicular area, which is in the fifth intercostal space where I would find the point of maximum, and that is where we would get the apical pulse. So now, if you could just do me a favor, I'm going to just have you take some dirt rest for me. Deep breath in, let it out. 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 All right, can you lift your arm? Deep breath in, let it out. Take a deep breath in, let it out. All right, lower this arm for me. Can you lift this arm? Deep breath in, let it out. Deep breath in, let it out. All right, I would inspect the back. Make sure that everything is symmetrical, no growths. I do notice that there is something there. I would check, I would document the elevation. I would document the diameter of it. I would document the color, the firmness, if there is any fluid in there, if I feel anything. I would, and also document the location of the area. So I would, if you could do me a favor, take a deep breath in, check one deep breath, let it out. Deep breath in. Let it out. Deep breath in. Let it out. Deep breath in. Let it out. All right. From here, we would I would have him do a rectal assessment, and pretty much he would be in a Sims position, and then I would look for things like redness, rashes, lesions. I will also look for hernias as well. So if you can do me a favor, since I'm going to have to be checking your abdomen, if you can just go to the bathroom for me. All right, so I see that his gait is really good. Nothing out of the ordinary. All right. And then if you can do me a favor before you have a seat, if you can have your arms in front of me, right there. All right, make sure that you're not swaying. If you can, can you come forward, please?
Yeah.
Okay. All right, if you can have the seat, please.
All right.
All right. And I would check your muscle strength. All right. If you can press your legs up against my hand. Press your legs. All right. All right, sir. All right. If you can please lay down here. All right. So I would obviously look to, first I would inspect to make sure that everything is symmetrical. I don't see no lumps. I don't see any discoloration or anything like that. And obviously, thank you. And I see everything is normal. So now I'm going to listen. I will start at the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. All right. From here, I can do the genitalia assessment. And pretty much for a male, I would check I would palpate the penis. I would palpate the scrotum and the testes. I will also pull back if there is foreskin to make sure that I don't see any type of infection or anything. There is one thing that they call it, it's called sphegma. So that's one thing you would look for. For a woman, you would open up the labia, and then you would inspect to see, for both you would inspect to see for discharge, any type of redness, rashes, lesions, bleeding, anything like that for the penis and the vagina. Now I will inspect the legs. First I will check the femoral arteries to make sure that they're both equally bilateral, +2, and the popliteal. Those are both equally bilateral, +2. We'll inspect the legs, make sure there's good hair distribution. I don't see no redness, no type of cuts or anything like that. I don't see any swellingness. It looks like everything is good. Then I would check the dorsal pedis. Those are equal bilaterally, +2, which is right here. Right here. Realize the video's there. Then I would check the tibia. Alright. I would check the capillary refill. Alrighty. And then as far as the pain assessment goes, obviously you would always do the PQRSTU method, and pretty much you would see what is the what provokes the pain, the quality of the pain, where the pain radiates. You would also check for to see the severity of the pain, and you have to be very the time of the pain, and be very understanding about the individual when they're going through the pain. So I believe that is it. Thank you so much.